All right, everyone, it is 12 p.m., so let's get this party started. I'm Meg Bruner, and I'm your host for today's Northwest ATTC webinar. I'm really excited about today's session, which is about a cool new toolkit about bringing access to telehealth to community spaces like public libraries. Let's see if I can get these slides moving. Oops, I did the thing I said don't do to our other person. Of course. Okay, a couple of quick housekeeping things. First, if you have any questions for our presenters today, please type them in the chat box at any time, and we'll try to answer as many as we can at the end of the session. Also, this slide's not usually there, so I'll just tell you this is the ATTC network. You can see where all of the different regional centers are across the country. We are in the Region 10 Northwest area up at the top left. All right, you'll also be getting an email at the end of today's webinar that has a link to a survey in it. Please take that survey as it helps us make sure we're bringing you the content you're interested in, and also helps us continue to bring you free and low-cost events like this one. That email will also have a link to download the slides from today and a link to our website where you'll be able to find a recording from today's webinar, which should be posted no later than tomorrow. We'll also be sending everyone who attends this live webinar a certificate of attendance, and it takes us about a week to send those out. You don't need to do anything to get that certificate unless you're watching this in a group. If that's the case, you can have someone in the group send us an email within 1 business day with a list of the names and email addresses of everyone in the group. That would be great. That way we can make sure everyone gets that certificate. Our email address is on the slide there. It's northwest@attcnetwork.org. All right, and with that, I am pleased to introduce our speakers today. We have Rachel Masitis from the Idaho Department of Health and Welfare, who helped develop a project to put telehealth pods in Idaho libraries and coordinated this toolkit project with the Northwest ATTC. Next, we have Mitch Doig, the co-director of the Northwest ATTC and one of the authors of the toolkit's content. It's hard to say the word toolkit for some reason. And finally, Erin McGraw, the UW Addictions, Drug, and Alcohol Institute's public information specialist who actually built the toolkit, and she's an expert on graphic design and instructional design. And they will be talking to you today about different aspects of the toolkit project. And so with that, take it away, Mitch. You'll be getting us started.
Thank you so much. Hi, everybody. As Meg said, my name is Mitch Doig. And before we get started today, I do want to offer a land acknowledgement, which kind of depending on where you're coming from, this could be very different. For me, I'm joining you from the native homelands of the Siletz, Grand Ronde, Cayuse, Umatilla, and Walla Walla tribes. There should be a link posted in the chat momentarily that'll allow you to figure out and identify which tribal nations that you might be located on. And really, this is kind of just a hope for us to apply a lens of cultural humility to the issues of diversity, equity, and inclusion for our work. And while we understand that this has pretty wide reach in our 4-state region, just know that this is really not a there's a lot of individuals here. So there's a link right there for you to be able to identify yours. Third space toolkit, building space for the telehealth in the libraries and the community. Really quick before we get started on this, I do want to let you know this project that is really coming to you from another center that many of us are team members on, the Center for Advancing Addiction Health Services, which is also at UW at ADAI. And really our goal is to offer services and supports that really accelerate the adoption and implementation of useful treatment and recovery practices. And so when we were approached to collaborate on this toolkit, this fell right into kind of our goals as improving the recovery and treatment practices in our region. Our hope when you signed up for this webinar is you really wanted to learn about the history of efforts in Idaho to implement these telehealth pods, learn about how we put this together, what our thought process were, and all of the decisions and key considerations we came to, and then to give you an opportunity to learn how to navigate this. We wanted to make this as available and accessible as possible, and so our end goal for today is that you can walk away saying, I know how to use it. But before all of that, I want to give an opportunity for somebody that I think is really, 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 really important to all of this to kind of share how it all came together, which is Rachel. And I'm going to turn things over to her just to give you a little bit of background for how this project came to be. Oh, 1 second, Rachel. I'm going to turn off my camera real quick. Ah. Hold on.
Good afternoon, everybody. I'm Rachel Masitis. I work for the Idaho Department of Health and Welfare. Today, I'm going to talk to you a little bit about the Idaho Telehealth Third Space Project and ultimately why we decided to provide this toolkit to other states in hopes that they can also develop the same toolkit that we're using today. I am using Mitch's slide, so a little bit difficult for me today. So ultimately, we received some funds through the American CARES Act with the substance use behavioral health grants supplemental. And we were looking at ways to be able to utilize that in order to expand some type of service availability throughout our state for rural residents. Like many of you probably have a very rural area, and in Idaho, we have a lot of frontier areas that we don't necessarily have internet access for. So a lot of discussion was based on COVID and the current pandemic that was taking place in 2020 and 2021, and how we can actually get folks to be able to see their providers during that time. What we ultimately landed on was providing technology to our libraries. And the way that we actually came across that was through our Chamber of Commerce in Idaho. Like many of you, we received some infrastructure support, and they utilize that infrastructure support to connect our libraries with some type of internet access or broadband access. And the cool part was a lot of our libraries were actually opening up their office spaces and or broom closets to provide telehealth access during the pandemic. And in fact, they actually increased Wi-Fi out into the local parking lot so that folks could come up and park in the parking lot and get services. The picture that you see here is actually from the Parma Library, which is a really small town outside of the major metropolitan area here in Idaho. And they are located, the library is located in an old bank. And the door that you see is to the telehealth space. And you notice that is a very thick doorway, and that doorway is actually to the old bank vault. In this picture, you're going to see another library. This is actually installation of one of our pods. A lot of the reasons that libraries fit this project so well is because they already have digital literacy education available. Most libraries provide some kind of literacy opportunities for their local folks to learn how to get on the internet, to be able to use email access, to be able to navigate. So it made it a pretty easy marriage to be able to put the two together. They also have a lot of information resources available. I work specifically in the division of behavioral health, and my actual career is dealing with substance use disorders. So for us, it's not easy for, I think, for any of us in medical health care or behavioral health care, but for us, it's a lot harder to be able to get our providers into areas that are very small, that they're able to have some type of access to services and to be able to get the resources available to them. There's also a lot of stigma attached in order to go into a treatment center, go into a facility, or receive some type of clinical or behavioral health services. So we knew that libraries provided some kind of safe place to go. It has the ambience that you need for anything that you need, and it would actually reduce some of the stigma in order to getting some service. Also, they have existing confidentiality and privacy laws available to them. A lot of you know that if you go into a library and you get a library card, it's actually a federal law that dictates what that information is used for. They have a lot of software availability where they ensure that no user data is actually carried over to the next person getting on. So if you log in at a local library, once you get off that, the data and the browser cookies, everything gets demolished right away, which isn't always something you can say about any place, including your home computer. And we in Idaho have worked very hard to ensure that we have reliable broadband access to as many libraries as possible, because even though towns might have, a number of different things, not all towns have pharmacies or clinics or healthcare, but we do have almost all towns in the state of Idaho with at least a very small or user-friendly community library that we can increase the access to. Here's a picture of one of our pods completely together. This is at our Ada County Community Library. You'll notice some of the privacy glass on the outside, as well as the blinds on the top, in order to make it feel a little bit less claustrophobic. We had some concerns about that, but it's easy. Can go in, shut that door, and nobody can see you inside the space. When we went through the process, we were looking at rural communities. In Idaho, we have a population of about 1.9 million, and that is across the entire state. I know a lot of folks probably on this call have cities or towns located that they're sitting in right now that have, over 1 million people. So we're pretty rural when it comes to where our people are located. In fact, a lot of our counties are actually considered frontier due to how many people per square mile there is. So again, we need access, and we knew we needed access, especially in those regions. So we targeted those rural communities that had a 30,000 people or less in population, which is actually quite a few of our towns and cities in the state of Idaho. They needed to have adequate space for a privacy area. Not all of our libraries had the ability to fit a pod or something this large into their library. Some of our libraries are actually like modulars outside the back of a sheriff's office, which is also a modular. So we really had to kind of think outside of the box, and adequate space could even be, a partition, which I'll go over in a second. They need to have the approval from their local fire inspector, which is very important to us because in the state of Idaho, our Idaho Commission for Libraries doesn't necessarily have oversight of our libraries in Idaho, but they do provide basically technical support, as well as a number of other services, but our libraries are actually either county or city taxing districts, ultimately. We also needed them to be able to be willing to manage a scheduling system for this space. We knew that there was going to be extra work. If you're in a library already, you're probably the main hub of the town, and there's a lot to do. So even though we can put a space there, we can provide all the equipment and the technology. We just need to make sure that they were willing to take on the extra duty of being able to schedule the space and ensure that its availability, at least so many hours, depending on size, a week. So we ultimately dubbed this the third space being not in a clinic or not in your home. There were a lot of things and lists on this slide that we ended up running into during the process of developing the program. From how do we get libraries who have very little bit of money to find scheduling systems, to what does this look like for HIPAA, how we're going to be able to safeguard the emotional and physical safety of our libraries when they're dealing with new and different behavioral health issues. We need to be able to ensure provider engagement, patron engagement, finding equipment through the state and through vendors. It was a lot. So every time that, it went through the next phase, there was a rock and we overturned that rock, and under that rock was another question, another question, another question. So ultimately, the reason that this guide came to fruition is because there was a lot of questions at a state level. How can this be done? There are a lot of local libraries who are amazing and are providing this service without necessarily getting any funding or any support outside of just their library or their, local state or their local city or county government. For us, it was a much bigger picture. So in our first round of libraries, we outfitted about 20 libraries. In the second round, we outfitted about another 20 more. So we're looking at about 40 libraries total in the state of Idaho just through our funding alone. The Blue Cross of Idaho Foundation also went ahead and funded another 6 libraries. So we have quite a few libraries in the state of Idaho. They'll ultimately be either currently active or will be active in the future. But there's a lot of questions that came up while we're doing this process. So as I gathered information and went to the team at Northwest ATTC, they were able to help me go through and guide me through processes that ultimately we needed some kind of information for our library staff to use. So we came up with 3 types of spaces. This is a picture of Salmon, Idaho's library. They outfitted some extra equipment in their little pod. What they're allowing for the staff that are coming in to utilize the space face to face. If you see on the table on my picture, it's on the right. And then, of course, patrons can come in and use the telehealth equipment on the left if they'd like to, because they do have travel nursing staff that come into the area. So it's an easy way to be able to meet people. So our first actual space type is the pod, which you see here. It's a modular pod. We could not use any funds to be able to expand the library itself in a brick and mortar way, but we did find the ability to be able to put in a modular system. So this is a cubicle. It's more than a cubicle. In the pod itself, it's got a ventilation system. It's got privacy glass. It's ADA compliant. The lights actually go off when you walk out, and they come back on when you walk in with motion sensors, and as well as the HVAC system. And the best part about this is it didn't require any wiring. It just needed to be plugged into a wall with a 120 volt amp, which was great. That makes it a lot easier. It's on wheels, although you can't see it. It also has mounting feet on the bottom. It can be pushed at any point in time if they need to be able to move it. And one thing that we really worked hard to find was a pod that would be compliant with any kind of fire extinguishing systems. So the pod top, the ceiling itself will drop out if the fire alarms go off, to allow any kind of water into that pod so that someone doesn't end up getting into any kind of trouble while they're trapped inside. So didn't want that, wanted safety first. We're also providing room dividers, which I don't have a picture of right now, but they are movable partitions that are on wheels, so they can be folded up and they can be put away for libraries that are much smaller. It helps create a flexible space so that libraries can utilize that space part of the time for this kind of service, video conferencing service, but also be able to put it away so that they can use their space for things like summer reading programs. And surprisingly enough, a lot of libraries were able to find, current existing spaces that we were able to repurpose for this, and they can move things around, of course, be flexible with that space, but also allow time for folks to be able to use it for telehealth or video conferencing needs. So again, we have 20 libraries active, and we are expecting another 20 libraries to be available by August of 2024. Our smallest population that we've outfitted, or we will be outfitting with services, is 143 people, which is amazing. That means 143 people that are about 2 hours away from their closest clinic will be able to at least mitigate some of that travel time by going to their local library and getting services. I think with that, I'm going to send it over to Mitch.
Thanks, Rachel. Okay, so this leads to kind of like how we came to develop this toolkit itself, and admittedly, I wish it was as easy as just slapping a sign on the outside of a library that says you can get library here and you can get therapy on here. And at face value, we would almost kind of assume like the two pieces of the pie that we really need to build something like this is some sort of library knowledge, as well as some sort of knowledge about clinical services and everything that kind of falls in there. However, one of the things that I think that perspective overlooks is the amount of institutional knowledge that exists both within a library setting and also in a clinical setting that has led to all of those kind of policies and procedures over time. And so we had to think, what are all of the pieces to the puzzle that we need? And what we found is that it actually takes like an entire village of people to make this work. And so we assembled a team, and the team included librarian knowledge, educational designer, who's on this call right now, some clinical expertise, administrative practices, a legal expert, the background of health science research and implementation, and ultimately also a 3D designer, so we could help actually picture what this would look like. And one of my big kind of cautionary things that I told people early on with this is I was a director of a clinical program at the start of COVID, and it was a very like interesting time to rapidly implement new service deliveries. And while that was happening, there were a lot of allowances given for confidentiality law and other things that made that challenging over time. Those have since passed, and so we don't get those abilities. So we had to develop a process to be able to go through, bring all of these expertise, these different individuals with expertise together and make something that is readable, understandable, and usable. And our hope was it would look like this. We put on our initial proposal when we were asked. We would do some interviews with some people from around the state of Idaho who had some library background, some people with clinical background, some community members. We could draft this toolkit, release this nice little PDF after we reviewed it, and it was all done. And unfortunately, what we actually found is it looked a lot more like this. Kind of to Rachel's point, every stone that we turned over kind of led to a bunch of other issues. And so one of the things that I think about early on, we were meeting with the individual who's kind of our legal expertise. And very, very often we would hear the statement, "That's a very interesting question." And every time that very interesting question was asked, what that meant was this is about to get a lot more complicated. And to be completely honest, I think that the more complicated this gets, the less likely this is that people will implement these spaces, create them, and then use them. So one of our tasks was to take a process that became more complicated and end up with a more simple product by the end as well. And so what we ended up needing to do is kind of take account of a couple of things. So one, what we found is providers, and this is probably not going to be a surprise to anybody, and I think we were probably just dreaming a little bit. Everybody that we wanted to talk to, very, very busy. And so ultimately what we ended up doing was scheduling about 15 to 30-minute phone calls with people and asking them a set of questions and saying, like, after hearing the purpose of this toolkit, like, what are the most important things you need to know? And the cool thing is this is by the time we had a lot of those interviews scheduled, we were pretty far in the process. And what we heard time and time again was that we were on the right track. And the common themes of that was that confidentiality law is scary, stigma is rampant, and resources are both necessary but also scarce. And so we had to kind of take all of that in mind and also design something that could be inclusive and accessible. So we worked for months internally and both separately and combined, drafting, revising, and then ultimately even settled on a different version of what this toolkit would look like. Rather than this kind of manual form, we decided a more interactive and self-paced option would probably be better. And so I'm excited that you'll get to see that today. After all of that, we reviewed it and then made the dang thing. So while we were doing this, though, this was kind of the framing of questions we were asking each other, ourselves, community members, which is what information is familiar to these non-healthcare entities. And you'll hear us kind of both throughout the toolkit and today talk about non-healthcare entity in addition to library settings. One of the really neat things that was proposed to us by Rachel and DHW was, could this toolkit be used? Yes, primarily to increase the access points for SUD services, but let's say people wanted to do more than that. How could we create this information and make it available for those utilities? So that was something in the back of our mind. What information or topic is most concerned to the people in those settings? And I think that that was a nice way for us to be able to think, like, immediately, how could we show people, yes, we have the answers for you. Then we were also asking clinicians what information feels crucial for the settings themselves to know. The other kind of part to this was, if you were explaining this to a client or any other kind of community member that you were helping, what information would you need to know in order to be able to accurately describe the space, accurately describe how to access the space, and also feel safe and comfortable knowing that this is a good place for your clients to get access to care. Then we are also asking folks, like, as a community member, what do you need to know? There was some really, really great ideas that came out of this, such as even having visual manuals available in the rooms for individuals that have different reading ability, or being able to how you describe this as you walk into a building. Like, all of these different things people were bringing to our attention that we really honestly hadn't thought of. Then we thought about, what are the risks involved? What are those opportunities that might exist as a result of this kind of novel idea? And then how best might we create and present this information and then maintain it over time? And ultimately, that's one of the reasons we went with this web-based tool, so that if things change, we can update this rather than worry about a PDF that maybe has been saved and then emailed 13 different times. And now if we were to release an update, it would be inaccurate. So as we were moving through that process, these are some of the guiding principles we had. So the first kind of major thing that always popped up in these conversations was confidentiality. So we wanted to be able to give the information during that implementation process that would allow these sites to kind of adhere and comply with confidentiality law where it applied to them, but also to avoid drifting into a design that would result in them being more responsible than they need to be for health information. And so a little bit of background here is that if, like, at any point in time, you could just create an allied health site that is aligned and related very, very closely with a behavioral health organization, but then all of those laws, regulations, everything applies to you because you're managing records and PHI. So we wanted to figure out, is there a way that these spaces could almost be autonomous if needed? So that was one of our kind of thought processes. Then, as Rachel had talked about during the initial Idaho pilot, we wanted these to be psychologically safe spaces. So we wanted the processes involved to access, the design of those spaces, and a lot of other factors, such as how staff interacts with individuals using the space, to be rooted in trauma-informed practices. And so that was this thing that was kind of always wrapping around every single section of this toolkit. Then this needed to be inclusive. So this is both in terms of different identities, but also, are they ADA accessible? Are they responsive to different technological abilities? Are they safe to use? Do people feel like they're private? All of those things. The other kind of elephant in the room here is stigma exists. And so we wanted to make sure that these spaces weren't contributing to stigma, and if possible, even reducing stigma. And we wanted them to be desirable to use. I think it was last year, the year before, the Northwest ATTC hosted a webinar on stigma in SUD settings. And I believe John Kelly, during that webinar, had said something to the effect of, in all actuality, the spaces that we use for SUD care should actually even be better than the general kind of healthcare spaces, just so we can show how important you are by accessing. So we wanted these spaces to feel important for you to access and positive, and not feel like you're going to a lesser space by choosing to get care. And then last, kind of all of these things mold into how accessible are these spaces really. If it's harder to use this space than it's maybe even worth for you, then they're probably going to be unused. And so we wanted to make sure that these were spaces that people wanted to, felt safe accessing, and then were kind of invited to use. But as we moved through that, again, there was kind of more challenges. And so these challenges were that not all the sites have the same resources. This could be financial, this could be space, this could be equipment. As Rachel was saying, that within the Idaho pilot, there's 3 different versions of this space that people might create for themselves. They might, for example, if you're doing this outside of this Idaho project that was mentioned, maybe you don't have the financial backing. So what can be done with equipment you might already have, things of that nature. The other part of this is there's differing perspectives. So maybe people don't like telehealth, or maybe there is an existing stigma. So is there ways that we can kind of, think about how we could address those? Differing expertise may be involved. You're going to have people that know a lot more or a lot less about this information. So how do we make sure that everybody has a kind of meets a bare or a baseline level of information in order to go about this? And then also there are some models for this that already exist. There's a pretty notable example within our region at the King County Library System. And but that doesn't fit all locations. And so we wanted to do something that was like flexible enough that people could use this regardless of where they were, and all of these factors. But the cool thing is like almost every one of these challenges did have opportunities. So of these opportunities, because all these libraries are different, this meant the design could be flexible, and that these options might be flexible based on the resources that are available. These might be opportunities to normalize SUD conditions as just something that our community members experience. That receiving care is a normal thing, and that using public spaces such as a library is a great thing to do. So with this opportunity there. Librarians are natural helpers and are skilled at acquiring, maintaining, and maintaining knowledge. And so this also felt like one of the best places to start. And there are some models for success. So we didn't have to reinvent the wheel. We just had to make a really streamlined wheel. And so what we came up with was these sections. And so each of these sections is within the toolkit. And the first being this telehealth and the need for the third space, which really is allowing an opportunity to provide some background on the project, why this is needed, why you might even be considering doing this. providing information on trauma-informed practices applicable both to the space, but also just more broadly in library settings. That was one of the really great findings, is that there are other people doing this work. Again, not reinventing the wheel, just making a streamlined one. We'll provide some guidance on confidentiality, understanding the governing laws, how protecting health information works, and avoiding any unnecessary risk or responsibility when possible. Reducing stigma, understanding the impact and dispelling myths. Evaluating the space. One of our kind of hopes moving in was that these would be sustainable environments. We don't want third space sites to get to a place where within a year they now don't have funding or the ability to continue. So some of the ways that you might be able to do that is by having a really good evaluation practice. So we provided information there. Then we wanted to actually be able to provide space and steps and processes for how you could implement this, and actually kind of what this works as in a day-to-day cycle, give you handouts and resources to be able to do that. And then finally, as you can imagine, there's a lot of information that can kind of bolster either your staff training and bolster these spaces. So we have a lot of resources available for that. The other thing here is that one of the reasons we went with this toolkit model was so that if libraries wanted to continue and sustain these spaces over time, their staff can use this toolkit as their onboarding, for example. But I could talk about this toolkit for days because I really love it and I'm really proud of everything that our team did. But what I would actually love to do is give an opportunity for Erin, our really great educational design team member, to show you how it all works. And let me give you control.
All right, let's see if I can get the slides going here. There we go. Hi, everybody. I'm Erin McGraw. I'm from the Addictions, Drug, and Alcohol Institute, and actually in a former life, I was directly a team member for the Northwest ATTC, and so I'm really happy to have been able to collaborate with them again for this project. I was the instructional designer for the toolkit, and so as Mish just said, I'll be giving you a quick demo of the toolkit and all of its really cool features. So the unique thing about this toolkit is that it is interactive and online. And so it was designed specifically for engagement and for learning enhancement. Another really great thing about it is that you can go at your own pace and you can revisit any piece of it at any time. So you can go back to a specific chapter or a specific section as needed as you're going through this process. There we go. And another great thing about it being online, it also works on almost all types of devices. If you're on a computer or a Mac, if you're on a laptop, a tablet, or a mobile device, it's responsive to all different kinds of devices and should work properly and look nice on all of them. Okay, so next we're gonna actually go in and I will show you what the toolkit looks like. All right, and hopefully everybody's seeing this all right. Okay, so here is the homepage. So when you look at it, it sort of functions as a table of contents. Each section and chapter is all available right here, so you can go through them in order, or you can go to one at a time, whichever one you need to go into and read more about. Each section also has an introduction and overview to kind of remind you of the context of what they're each about, and they also each, as relevant, have a additional resources and or references page. So if you're looking for sort of the science behind what's in the content, you can find that there, or you can find additional resources that our content experts have put together, which is really great. So now we're going to go into it. So as you can see, just in this welcome and introduction page, it has this menu bar on the left, which is great for navigating through all of the different chapters at any point while you're in it. You can look at your progress as you go through the different pages. So you can see up here, it'll show as you complete pages how much of the entire toolkit you've done, and it also shows you per chapter how much of the page you've been scrolling through, so you can really keep track of where you are. You can come back to it and it'll save your progress, so you can hop right back in and keep reading. This menu bar on the left also has a really neat search function. So if you're looking for a specific term or a specific topic and you want to find all the places where that shows up in the toolkit, so say you're looking for to learn more about being trauma informed, you could search for trauma, and it should, let's see if I can get this to pop up for us here. There we go. So it'll show you each instance where the word trauma shows up within the toolkit. So you can do that for any term that you might want to go look for. And the nice thing about this menu on the left too is that it is collapsible. So if you're sick of looking at this, you just want to focus on the content, you can collapse it and reopen it back up as needed. And in fact, on mobile, because it's such a small screen, it starts off collapsed, and you can then choose to open it up if you wish. All right, and the last just little quick thing about navigating through the toolkit is that you can do it sequentially. So at the bottom and top of each page, you can go back or you can go forwards. So that's kind of how you get through the toolkit. So moving on to just generally how it looks and how it works, we will go into this section that we're already there. Well, that is very handy. All right, so as you've seen a little bit already, the toolkit is fully animated, and it's really rich with graphics and things to support the content and really support reading comprehension and learning from the toolkit, which is really, really great. It's not just a giant block of text. The content is broken up with these different elements to kind of keep things interesting and really support the points that we're trying to make. So here's just a little look of what that looks like too. There's sort of these different elements of interest that get propped out. And here I'll get rid of that search so it stops highlighting those words. And really just trying to emphasize certain points to make sure that they are really highlighted. And another really great thing is where relevant, there's these sort of call outs for additional resources woven into the content. So if you wanted to learn more about a specific topic, where our content experts have put together these extra resources, they exist within the content there, and you can learn more if you're interested in learning more about that. And in fact, at the very end of the toolkit, there's sort of a full all resources and references section. You can download the full reference list if you're interested. And you can also find a really rich list of additional resources that are sort of on this broad range of topics, from telehealth tools for patrons, general telehealth resources specifically to libraries, a lot more about trauma-informed practice, evaluation, confidentiality. There's a section for crisis help resources that would be really helpful for putting together your own resource list potentially, and self-care for library staff. So just tons of really great resources that we've gathered all together at the end there. But you'll also see these woven, many of them woven throughout the content as well. All right, so let's go back to that trauma section just to show you another kind of cool piece. You saw an image of this in Mitch's portion, but I just wanted to show off this virtual space a little bit more. This is sort of our first sneak peek of it, and we'll see a lot more of it in just a little bit. But it's a really cool feature because it shows all of the sort of important elements that you would need to consider when making your own space, and how they relate to the different topics in the toolkit. So in this instance, it's sort of calling out how these specific elements in the room relate to trauma-informed practice. And in the stigma section, it's how those elements relate to being anti-stigmatizing. And in the confidentiality section, how they relate to making sure that you have a confidential and private space. So it's a very cool thing that we had made to put into this toolkit, and really kind of can show you all of these really specific elements that are great to consider. And another great thing we have is, let's see if I can find it here. We've also developed a few extra handouts. So as an example, we have this checklist for designing a trauma-informed telehealth space. It's an interactive checklist that you can use right here online, but if it would be helpful to also be able to print this out and check it off in person, we have made that handout. So there's a few of those handouts throughout the toolkit. And they're also all congregated at the end, so you can download them all at the same time, or if you need to find a specific one, we make it easy that way. Some examples of what these handouts are: we've got checklists like this, we've got some sample space policies to help people kind of create their own and just see what that might look like. And also we have a really cool one on words, anti-stigmatizing language, that, words matter. So some very cool handouts. Another really cool feature in the toolkit is sort of incorporating these realistic scenarios. So you can kind of get a sense of what a challenging situation might be and how someone might handle that in a trauma-informed or an anti-stigmatizing way. So here in this trauma-informed chapter, we have these case scenarios with sort of a story type way of presenting it. And we give different ways that are directly related to trauma-informed research on how you might think about that interaction and possible strategies for handling it. So there's two of those here, and yeah, just really great ways to reflect on that and think about what tools you might need to handle that kind of situation. Another example of this kind of real life scenarios that we've woven in, let's see, I believe it's in this page. We have this sort of fictional character that represents sort of a composite of people that might patronize the spaces. And so it kind of goes through just a little fictional story, but she kind of gets followed throughout the whole section as a way to kind of bring it back to this sort of framing of how would you think about your patrons in an anti-stigmatizing way. So she kind of shows up through each of them, which is pretty fun. All right. So then the other thing I wanted to make sure to show was the fact that the toolkit features just tons of recommendations and tips and best practices. So it's really giving a lot of rich information on how you might think about things or how you might frame things when you're kind of considering making your own space. So let me show you a couple examples of that. So here, this is a list that kind of gives different ideas, different specific ways to make sure that the space is built with reducing stigma in mind. So things like creating specific handouts or posting welcoming signs in and outside of the space, considerations for planning how people interact with the space and responding to their needs, that kind of stuff. And it's really cool as a sort of step-by-step thing. Another example is in the evaluation section, we kind of give this step-by-step guide. So if you're new to evaluation or you're just looking for sort of the different pieces to consider, we include this sort of step-by-step way of relating that information, which I think is really helpful. And the last example I'll show is in our confidentiality section. There is a really, let's see, it's in this one, I believe. There's a really neat table here that sort of gives an example of different points of contacts that the setting might have with patrons, and our suggestion for how to handle talking with them that keeps confidentiality in mind. So again, just lots and lots of examples, which I think is really, really helpful. So the last thing I'm going to show you, which I am excited about because I think it's one of the coolest things about this toolkit, is that we have this 3D model space. So I showed you some still images from it, that sort of virtual space I was talking about, but it's actually also an interactive 3D model. And so I'm going to show you what that looks like here. We can load it in. And I'll full screen this so we can really see it. So you can zoom in, you can click and drag to see different views of the room and really look at how things are situated, which I love. And you also see these numbered bubbles, and those correspond to the different items in the room and why they're important, why it's there, what kind of item might work best in the space and why, and also just its recommended placement in the room that's keeping all of those elements in mind of being trauma-informed, being anti-stigmatizing, and confidential. So an example of what it looks like when you click on one of those, it shows you what the item is and yeah, sort of why it's there and different considerations to have when you're thinking about putting specific items in. So just a really cool element. And this section too also includes a handout with a checklist to help people and organizations kind of do this for themselves. Some really great recommendations specific to what technology to have and why, what kind of education to have, how to make your room soundproof and make it confidential and private, what kind of software you might need. Just really, it goes through in really great detail for how to actually put the space together. And again, it has examples for making policies and procedures, how to do scheduling so that you're not accidentally sharing private information, private health information, that kind of stuff. So just really great suggestions. So if any piece of it you're not really sure where to start, this toolkit will really kind of give you everything you need. I think we've really tried to think it through and give everything we could to help you make your sort of unique space to your settings unique needs. All right. So that is it for that portion. I'll let Mitch get the slides back up. If there, I think the URL for this space is still upcoming in the slides, but thank you everybody for watching me show that off.
Thank
Thanks
you,
for showing it
Erin.
off too, Erin.
Yeah.
Yeah, so it's in the slides that I believe Meg sent out, and I can let Meg give these little things.
Yeah, I did. I posted a link in the chat. And again, everyone who is at this event is the first to get the link to the toolkit. So yay, that's your reward for coming to our webinar today. Thank you so much. It looks like we have a few questions in the chat, and please take this moment to ask any more. We do have about 10 minutes. The first one was, I think for you, Rachel, when you were talking about the Idaho project, someone asked, is there a list of places or libraries where the pods are already located? And Dana Abbey replied with a link to the NRTRC website with a link to, I think is national for where there's telehealth resources across the country. But I think this person was asking specifically about the Idaho project. Is there a link of the Idaho libraries?
There is a link. If you go to the Idaho Commission for Libraries Telehealth, they update it all the time, and they include the same link that you were given by Abby.
Oh,
But
okay, cool.
I will post that link in the chat so that you can go and check at any point in time as we get these up and moving forward.
Great, thank you. All right, the next question was, I see that many of the locations listed in my area, I assume on that NRTRC link, are health clinics. Do people need to be existing patients of those clinics and see the clinic providers to use the pods?
That's a great question. So if you go to that website and you actually click the little button that says TAPS up in the left-hand corner and turn it orange, that will give you all the telehealth access points. You don't necessarily need to go through a clinic. So we talked a little bit about King County Library, and what they did was actually get a partnership with a local healthcare consortium so that they could provide services only for that healthcare consortium. we're a little concerned with that just because Idaho's landscape is a little bit difficult to navigate when it comes to be able to get clinical services or behavioral health services. So what we did was we kind of developed a wedding. The best example I can come up with is a wedding venue. So the idea is that there's a space available. You're the one that needs to get your caterer and your officiant in order to have that wedding, but ultimately it really is on the patron and on the provider in order to set that up. So you could go to, which is great. In the state of Idaho, there is a law recently passed by our legislators to allow anyone in good standing from other states to be able to provide services in Idaho. So if I wanted to see a behavioral specialist in, say, Utah, I would just need to call my specialist, make sure I get a link in my email. Our providers at any library, librarians can tell me how to get onto that link, and I can just set up my own appointments for anything that I need to. So it's either or. It really is. We're hoping to give you kind of a foundation for setting up a service like this and setting up maybe in a more of a mass setting. For us, it was a lot. We have a lot in the state of Idaho at this point, a lot more than other states do. But if you did want to go through and actually work with just clinics, specific clinics, that really is up to you.
The next question is, how did you address implicit bias with persons providing the services? And I'm not sure if that is about the healthcare providers or the library staff, really. Mitch, you're nodding a lot, so.
Yeah, it's a fun question, right? Because I
Yeah, it's a
think
good
we
question.
we only have so much that we can package in the toolkit. So one of those,
Yeah.
I believe, is there is a resource to the implicit bias quiz. I think part of it is just the framing. I think that this is something that Aaron highlighted, and we tried as much as possible to kind of humanize the examples we were giving, and so that's one of the reasons that I think that those kind of like fake patient examples are really helpful, is to just kind of see how that might manifest rather than have to do the self-reflection, because I think the hope is that that'll lead to the self-reflection eventually. But we can only do so much. So it's a little bit of both, but I think for this is very much geared towards the library staff or the third space staff as opposed to the clinical side of this. So we don't really have as much of an impact on the clinical services aspect, but I do think it's really, really important. And I'll note that for future ideas.
Thank you. All right, next question. Are there moves to provide a broader set of telehealth services in these spaces, for example, HCV treatment?
So again, that we've left it up to the patron and the client to ultimately make the decision with their provider. So, I have some libraries that have opened up to domestic violence classes within there, and so they're allowing kind of a group therapy set up just for that particular provider. It really is up to the space that's providing the service, and it is up to the clinic that's willing to give that service, or that provider that's willing to give that service. In my opinion, we haven't really dictated to the libraries in Idaho that they only can provide telehealth, even though we've provided the equipment. We've asked them to think of other options to include things like, job interviews and video conferences and test proctoring, so that we can mitigate the possibility that somebody using the space is seen as only using the space for telehealth. So I think really the sky's the limit. We have a great library in Mountain Home. It's right next to our Air Force Base, which is a really large Air Force base in Idaho. And they're providing things like legal services, free legal services that can be utilized. And they've created a relationship with a local legal group that provides services to our veterans and our active duty. So I think it's great. I think you can pretty much use the space for anything and fill in some gaps. Of course, our number one thing that we want to be able to fill gaps in is our behavioral health and our services throughout the state. But there's a lot of opportunity there. If it's not being used for that, there could be a possibility to use it for anything else.
There is also one reason that's doubly important too, is being able to both advertise and use these spaces for both health and non-health related reasons is part of what's going to give that deniability that a person entering the space is only there to access a certain type of care. That's also one of the reasons you'll see in the toolkit, like even location where these pods or these rooms might be, just so people aren't like seeing like, oh, there's somebody walking in and out of here, and then they're talking on the phone and then coming out and being upset or something like that, or coming out and having a prescription or whatever those things are. And so being able to offer that for health and non-health kind of helps that space be more confidential in a funny way.
Okay, next question. Rachel, can you speak at all to the average cost to get a space like this up and going?
So the average, we had to use, well, this is a great question. It probably come up. So again, we use substance use prevention and block grant funds in order to do this. So we use one-time funding and supplemental, and it is something that could be utilized in any, I think, in any block grant. I mean, realistically, or through HRSA grants, there's a lot of telehealth availability there. So for our purposes, because I work for the state, I was able to go through a state vendor to provide what we call capital outlay or large supply equipment to the libraries as a special municipality, which means they're also a local government agency. So for that purpose, I was able to do it tax exempt. The entire pod with all of the furniture and equipment inside of it cost me about $12,000. If it was just a partition or an existing space, we were looking more at about $3,000 to set that up. We have one library that will be providing kind of a different set of rooms with equipment that can be kind of rented out and taken to that room at any time, so that they're not having one particular privacy space as whatever space is available. That was all of $1,200 to put Chromebooks there. So I think there's a lot of flexibility. We did not purchase any medical equipment for that. We didn't, there's a lot of concern there. Do we provide medical equipment to libraries? And then what happens if, say, the blood pressure cuff is being used and there's a high blood pressure? What can a librarian do about that? And where are the boundaries? So we definitely just went with the electronics and privacy area. Everything else is really up to a library and up to the staff that are placing.
So we're getting a little short on time, so I'm going to rope a couple of questions together. And Rachel, sorry, all the questions are for Rachel, but of course they are, because that project is so fascinating. But Rachel, what has the usage of the pods been like, and how are you evaluating this project and thinking about sustainability going forward for this project?
So we'll be putting out quarterly Survey Monkey, basically to ask about usage throughout the week. We can't specifically ask how often it's used for telehealth, because again, we haven't mandated that, libraries are only using the service for telehealth. So for our purposes, it is kind of here's an overarching idea of usage. With that being said, it really is dependent on how big the town is. So I have one small town that ended up having it used 3 times, but when you're looking at percentages of 225 people 3 times in the last month, well, that's a pretty big percentage of the population. I think it's new, so I think that's also going to be a big change. We have a lot of local providers that we're trying not to alienate, so we're trying to ensure that they understand that the pod is not to get better services from a different area, and that's been kind of difficult. But it's just a continuation of marketing, ensuring people feel safe and comfortable. We've had lots of people actually go in from the VA, and we'll be having a meeting with the VA very soon to talk about services through TRICARE. So if you ask me in a year, I can give you a lot of information about services and percentages, but right now I don't necessarily have a hard and fast number based on populations.
Sure. All right. Well, thank you so much, everyone. I just want to mention, in case you didn't notice it, that we did make one person cry tears of joy, which I think is the highest praise I've ever seen in a Northwest ATTC webinar. So thank you to the person who posted that. That's very nice. I do want to mention our next webinar is next month at on June 26th at 11 a.m. and it will be on opioid clinical decision support in primary care. And I will include a link to that in the email. I'll send that later today. And that email will also have some links to some resources shared today, a link to the toolkit, lots of links, all the links. Thank you so much, Mitch, Rachel, and Aaron, for coming today. Thank you for showing us this amazing toolkit. I'm so excited that it has been launched. I'm sure you're all also very excited that it has been launched and it is out of your lives. Thank you so much for all your incredible work and for joining us today. Fly, be free, and have a wonderful afternoon.
Thanks,
All right.
everybody.
Everybody.
Bye, everybody.